Dear viewers, we are back from a report, and of course we have a very medical episode this evening. Actually, Tariq, our first guest, is a neurologist and our second guest is an ophthalmologist. So I think it's going to be a really great one. That's right. We're looking forward to meeting our guests very shortly this evening right here on Ya Hala Kuwait.
Stay tuned for the next guest.
Dear viewers, we are back from this amazing song, and of course we have been joined by our second and final guest for this evening, Dr.Reshma Ravindra, Registrar Ophthalmologist. Good evening and welcome to Ya Hala Kuwait.
Thank you for having me here, Rita. How are you?
Great, thank you. And I'm really glad that you are with us this evening because you're going to help us understand how to take care of our eyes and of course the different diseases out there.
Yes.
So in the beginning, can you tell us about your educational and professional journey in ophthalmology?
Okay, so in med school, my favorite subject was ophthalmology. So I had no doubts, you know, when I had to do my residency, it was always ophthalmology. So that's what I chose. And in my residency, I was exposed to all the subspecialties we have in ophthalmology.
Yes.
Like the cornea, retina, and squint. So basically over the years, I have been exposed to many clinical and surgical settings. So I've gained experience to give good quality healthcare.
That is really amazing, and today we're going to be learning from you, which I think is even better.
Thank you.
So what subspecialty do you focus on within ophthalmology? You mentioned a few.
Yes,
which one did you go with?
So see, when everyone looks at the eye, they think it's just one structure. It's small, what can you possibly know about it?
Right.
But every layer of the eye is a subspecialty by itself. So for me, like, you know, the cornea, retina, glaucoma, all of these. But for me, I personally love comprehensive ophthalmology because it has a little bit of everything in it.
Nice.
And you know, so I get to see everything. So
That's amazing.
I would choose comprehensive ophthalmology.
That's really great. I think when it comes to our eyes, a lot of us don't know how we should take care of them, when we should go to the ophthalmologist, and most of the time we show up at the doctor's office when we have an infection or something wrong, right? It's never just a checkup.
It's never just an annual checkup.
Exactly. So what are the most common eye conditions that you see in the office or even treat?
Yeah, the most common eye conditions that I see or treat here especially are dry eye or jafaf. It is so common you wouldn't believe it. And apart from that is allergies or hashasia. Right, it's very common amongst the patients here.
Right.
Apart from that, refractive errors. You know, in children we have myopia, NHRAF, like you said, astigmatism. They might need glasses or contact lenses or anything like that for correction. And one more important thing is presbyopia. You know, where above the age of 40, you've seen people do this with their phones, go back and forth, right? Yes, that is because they can't see near very clearly, so they need help. With the help of glasses, they, you know, do really good. Amazing. And you must have also heard of myopia or cataract.
Right, a lot, yes.
So that also comes with age. So that is also very common. And glaucoma, which is increased eye pressure or ion duct, that is also commonly seen. And the most important is diabetic retinopathy. Okay.
Right.
So those who have diabetes should screen their eyes every year to see if their shabakia or the retina is okay or not okay.
Definitely.
So that is very important.
I think that's really great advice when it comes to patient care and how much they should be seeing their ophthalmologist.
Especially diabetics, they don't know about this.
Yes, I can imagine that a lot of people would need this piece of information. So now that we know the conditions that are very common, how do you approach diagnosing and treating eye diseases? So
I believe in first developing a rapport. I love knowing more about my patients because I feel that they are the best to tell me about their condition, right? So talk to them and then get a detailed family history because many patients, many conditions are associated with family histories, right? So that is important, and also their medication history because so many medicines, you know, we'll get to know what their systemic conditions are, and so many medications by itself cause ocular problems.
Definitely.
So that is important. And once we take a detailed history, we do their vision screening, we examine their eyes in a slit lamp like in a machine where we can see the magnified parts of the eyes, you know, it's beautiful. And we check their shabakia and their pressure. So when it comes to treatment, it's tailor-made for every patient because every patient is different, their needs are different. So it is tailor-made. Some might require just medicines, some might require just drops or gatra, Some might require spectacles, contact lenses. So it's tailor-made for every patient.
Definitely, which is very important. I think, as you mentioned, everything plays a role, medication, age, and everything that comes with it. So what advancements in ophthalmology have significantly improved patient care in recent years?
So medicine is evolving as we speak right now. Yes, so there are so many advances in terms of diagnosis or treatment. So for example, in diagnosis, there's something called OCT, okay, optical coherence tomography, where you can't believe it. Every layer of the retina, you know, it shows us how it is, which helps us not only in treatment, but also in surgery. You know, it really helps us to know where exactly and how to go about it.
Yes.
And laser treatments, okay. So these have also, significantly improve the outcome of the patient.
That's right.
Yes, and now they're minimal invasive techniques, so that you don't have to go through long tedious surgeries. Okay, there's there's less complications, faster visual outcomes, and all of those, like in glaucoma surgeries. So yeah, there are a lot of advancements.
A lot of advancements always with medicine, which I think we're all very thankful for.
Yes, really, we have
definitely. Things are changing all the time, and patient care has become better for sure. So in the beginning of the interview, we spoke about how us as patients, when it comes to our eyes, we don't know when to see the doctor, how to take care of our eyes. So how do you educate patients on maintaining good eye health, and how often should they be seeing their doctor without having an issue?
Yes, that's very important actually, because honestly, prevention is better than cure, right? So especially in ophthalmology, there's so many conditions like refractive error or glaucoma or diabetes. They don't have any symptoms. Okay, so later when they come with symptoms, it is too late in the disease to get back good vision.
That's right.
Okay, so that's very difficult. So these things have to be checked annually. So for example, I tell all my patients, irrespective, you have to come for an annual checkup. Frequent eye checkups are required, irrespective of your symptoms.
Yes.
You know, from a young age, from before they join school, you start checking them at that age. So apart from that, nowadays screen time management. Everyone has a screen, from phones, from children to adults. They have phones or tablets or desktops, laptops, all of this. That causes a lot of eye strain.
That's right.
So the most important rule to follow here is the 20-20-20 rule. Okay, you must have heard of it. So it is every 20 minutes, take a break for 20 seconds and look at something 20 feet away.
Wow.
Okay, so this will relax your eyes. This is very important in screen management, you know, to prevent digital eye strain, which is actually a thing now.
Definitely.
Okay? Yes, and for UV protection, I would recommend them to wear sunglasses, okay, which have UV filters. And those who work on the computer screens a lot, there's something called a blue light filter in glasses, okay, which protects them from UV rays and the blue harmful rays from the screens. So that is very important. A healthy diet, okay, rich in vitamin A and antioxidants, will also help in maintaining good eye health. And if they have chronic diseases like diabetes and hypertension, definitely monitor and control those chronic conditions. So that will improve your eye health.
Definitely. I think that's really great advice, and something we could really use to take care of our eyes between our checkups with our doctor.
So that you're not too late. So that is the main aim. Yes.
Definitely. Focus on preventing before we're dealing with the actual issue. So lately technology is involved in every sector, and definitely in medicine, heavily in medicine actually. So what role does technology play in modern ophthalmology?
So technology in ophthalmology right now helps in accurate diagnosis, speedy diagnosis, okay, and has more innovations in treatment, and definitely improved surgical outcome. You know, the complications are less and the visual recovery is faster. Okay, so all this is definitely because of technology. So we have something called OCT, like I told you earlier. We have photo slit lamps, fundus photos, so we can take real-time image and we can monitor the disease as it goes along, and we can show the patients. Now when the patient knows what's happening, can see what is happening, obviously he's more happier. He understands the disease better.
That's right.
And he'll follow up better. Right?
Yes.
And in technology also, artificial intelligence plays a really important role. And telemedicine. So telemedicine is where we don't need doctors in every rural area, you know. We have technicians and trained people who can go capture images and transfer it in time to the doctor sitting somewhere else. and based on which they can evaluate and treat them. So, you know, in those underserved areas and rural areas, this really helps, and thanks to technology.
Definitely, it's amazing because I can imagine that people would have had to travel a lot just to go to their checkup and check out their eyes.
So to follow up and for detection, and those who do not have access to healthcare, it's really working wonders.
I can imagine.
And there's also bionic eyes, you know, bionic eyes and retinal implants. Because of technology, we have all these, which at least gives some hope to people with advanced eye diseases.
Definitely, because I think when it's at a later stage and there's not much to do, that would bring a lot of hope to the patients, for sure. So how has laser eye surgery evolved over the years? I know that it's been there for at least a decade or two, but what is it like today?
So earlier it was mainly used for refractive errors, right? So it was the first ever one was photorefractive keratectomy. So after that we came to LASIK. Now everyone knows LASIK and everyone is comfortable and happy without spectacles because of LASIK. But because of the advancement in laser, there's a new procedure called SMILE. Small incision lenticular extraction. So there's no flap created, nothing. A small lenticule is removed from the cornea. Okay, so the post-operative vision recovery is better. The speed and recovery is better. You know, the complications are fewer. So it really helps.
That's amazing.
And also laser works in glaucoma and diabetic retinopathy treatments. So it's definitely evolved.
Laser is definitely helpful when it comes to surgical eye treatments out there, and I think also AI has a lot to do with a lot of treatments we're getting done now. So how do you think the future of ophthalmology is going to be with AI and robotics?
AI definitely helps in detecting diseases already, in early detection of diseases like diabetic retinopathy and glaucoma. And I think in future it will also help us make tailor-made programming treatments and early diagnosis of diseases. And robotic surgery is amazing because it gives us most precise incisions, and in complicated surgeries and complex surgeries it definitely helps us, you know, the precision definitely helps because of robotic surgery. So it has definitely revolutionized eye care.
Definitely. I think it's such a great change and advancement in the industry. And Dr. Reshma, thank you so much for all the information you've given us this evening, and of course for being with us.
Thank you for having me.
Thank you. My pleasure. Dear viewers, we had with us Dr. Reshma Ravindra, Registrar Ophthalmologist. And up next we have a report on the opening ceremony of the 15th International Invention Fair in the Middle East. Stay tuned.